Hey everyone, it's Deepthi. Let's talk about something that affects many women, pelvic pain. We've all had our fair share of aches and pains, but with pelvic pain, listen to your body. It can be caused by periods or more serious conditions. Think of me as your guide to understanding pelvic pain. Okay, let's start with ovulation pain. This usually happens around the middle of your menstrual cycle like clockwork. Some women feel a slight twinge, others might feel a sharper, more noticeable pain, kind of like a quick cramp on one side of your lower abdomen. If the pain is super intense or sticks around longer than usual, don't hesitate to give your doctor a call. It's always better to be safe than sorry, right?
Menstrual cramps, those lovely monthly visitors we all know and kind of dread. That aching, cramping pain in your lower abdomen. It's like your uterus is doing a workout. Your uterus contracts to shed its lining. For some, cramps are mild, but for others, they can be debilitating. If cramps mess with your life, talk to your doctor.
Now let's talk about endometriosis. Imagine this. The tissue that normally lines your uterus decides to go on an adventure, growing outside of your uterus like on your ovaries or fallopian tubes. This rogue tissue acts just like it would inside your uterus, thickening, breaking down, and bleeding during your menstrual cycle. But here's the catch. This blood has nowhere to go, so it gets trapped, causing inflammation, pain, and even scar tissue. Endometriosis pain can range from mild to severe, and it can really put a damper on your life.
Let's talk about pelvic inflammatory disease, or PID. It affects the uterus, fallopian tubes, or ovaries. PID is usually caused by untreated STIs and can lead to serious complications. Symptoms include lower abdominal pain, fever, and unusual discharge. If you notice these symptoms, see a doctor immediately. All right, let's talk about UTIs. We've all been there, right? That burning sensation when you pee, the constant urge to go, and that nagging pain in your lower abdomen. UTIs happen when bacteria sneak their way into your urinary tract, causing an infection. UTIs usually respond well to antibiotics, so if you suspect you have one, don't suffer in silence. Head to your doctor. Next up, we have kidney stones. These little troublemakers are like tiny, hard deposits that form in your kidneys, kind of like nature's version of a rock collection, but not as fun. When these stones travel down your urinary tract, it can cause some serious pain, and I'm talking excruciating, can't even think straight kind of pain. The pain usually starts in your back or side and radiates down to your lower abdomen and groin. If you're experiencing severe pain or see blood in your urine, it's crucial to seek medical attention immediately. Now let's talk about ovarian cysts. These are fluid-filled sacs that can develop on or in your ovaries. Most of the time they're totally harmless and go away on their own, like little bubbles that pop without you even noticing. But sometimes these cysts can grow large and rupture, causing sudden sharp pain in your lower abdomen. If you experience any of these symptoms, especially if the pain is severe, it's always best to get checked out by a doctor.
Let's move on to fibroids. These are non-cancerous growths that develop in or on the uterus. They're actually quite common, and most women with fibroids don't even know they have them. However, sometimes these fibroids can grow large and cause a whole host of problems, like heavy menstrual bleeding, pelvic pain, and even fertility issues. If you're experiencing any unusual symptoms, like heavy periods or pelvic pain, it's always a good idea to talk to your doctor. They can help you figure out if fibroids are the culprit and discuss treatment options if needed.
Let's talk about pregnancy. Pregnancy is a beautiful, magical time, and it is, but it can come with aches and pains, especially in the pelvic region. As your baby grows, your uterus expands, putting pressure on your pelvic bones, muscles, and ligaments. If you experience sudden, severe, or persistent pain, it could signal a complication. Don't hesitate to reach out to your doctor or midwife.
So there you have it, a crash course on pelvic pain. Remember, you are your own best advocate. If you're experiencing any pelvic pain, talk to your doctor. Early diagnosis and treatment are key. For mild discomfort, try a warm compress or pain relievers. Relaxation techniques like deep breathing or meditation help. Listen to your body and seek help when needed.